I grew up in Oklahoma City and went to Oklahoma State University for undergraduate and also medical school. With an effort to help people, I think it was natural to go into medicine. I think when I was in high school, I found science interesting, and it's a perfect venue to do something good in the world. I was one of those kids that was always working. I was mowing grass by the time I could push a mower. I think my first real job with a paycheck was at a gas station about a couple of blocks from my home. I was pumping gas and washing windshields, and eventually got to the point where they let me do oil changes, and I worked there through high school. Well, I've just found it interesting. During medical school, we studied neuroscience and the neurological systems of the body, and there was a notion that it was sort of the last frontier in medicine. You've got other systems like the heart. It's a muscle, it pumps blood, but the brain is different in that there were diseases that we've known about, but never really knew why people would contract these illnesses and diseases. There have been new medications for migraine, for example, for stroke, ALS, Parkinson's disease, and it's really been exciting to have things to offer patients that we really didn't have before. Well, BJC is just a wonderful hospital system to work for, and I've been on staff at other hospital systems. BJC is just such a welcoming community, and the staff and administration, it's really refreshing to work here, and we've been well received, and I'm excited about some of the things we're going to do here at St. Peter's and Progress West, particularly with the stroke program. There is a stroke program where Barnes St. Peter's will be a level 2 center, meaning that we can take patients, give them the clot-busting drug, and care for them here in the ICU or the general medical floor. Progress West is going to be involved also, where they'll be level 3. They in fact have a robot in the emergency room, so that the stroke victim comes to the ER, and the doctors down at BJH, Big Barnes, will communicate through the robot to the patient, have a nurse or doctor, or ER doctor, do an exam that the specialist downtown will also be able to visualize and direct care. And then, of course, if there's a patient that requires even further care for the stroke, we can have them flown to Kings Highway at Big Barnes, and the doctors will receive them there and care for them with some of the latest cutting-edge technology that's available in the world.